So we're talking about diabetes, Dr. Hill. How do we know when we have diabetes?
That is a great question. So there are things that you can be looking out for as an individual who is either concerned about it or just wants to know more about the current status. You can be looking for symptoms, how you feel, particular things that will arise, and you can also go to a doctor. You can come to our office and get tested for more objective measures like a blood test. So both of those are very valuable in their context. They'll let you know if you have diabetes or if you're on the path towards diabetes. And there are a number of things that you can keep on your radar. And if you want to talk about some of those, Pops, go for it.
Well, when people come into the office, we typically have to look at their lifestyle, how they live, what they eat. Since diabetes, type 1 diabetes is a pancreatic disease and type 2 diabetes is a liver disease, you really have to look at some of the organ function to find out what the problem is. And sometimes you won't see any symptoms of diabetes, but you'll see liver problems, and that sets you off to have a better understanding of that we're dealing with a diabetic patient. One of the blood tests that we run when we're looking for diabetes in a patient is the A1C test, which is glycohemoglobin. It's a blood test, and when you run that, it measures the amount of sugar in a red blood cell. The red blood cell lives about 90 days. And so what it does is it gives us an idea of how much sugar is in your bloodstream in a 90-day period of time, which is much more accurate than a glucose test, which measures what sugar's in the blood at that moment. When you measure a glycohemoglobin, the normal glycohemoglobin would be in the mid 5.5, 5.6 range. When you get up to the 5.8, 5.9 range, you're pre-diabetic, and anything over 6.2, you're in full-blown type 2 diabetes. When we look at American lifestyle today, the sad part about the glycohemoglobin with children is that because children eat so much sugar, they consume so much of it, the American College of Pediatrics has had to increase the A1C normal up to over 8. And the sad part about that is when all those children become adults, they'll all be diabetics, because it's measuring the average of what a normal child's A1C is. And so it's kind of like if everybody got C's on a test, we'll make the C's an A so everybody passes. And it doesn't make any sense, but you can't control a kid's diet from a medical standpoint. The parents have to make those choices. And we try to deal with that in the patients that come in to see us. We want to take and change that so we don't have to treat the disease. We want to prevent it from ever starting in the first place.
So that's a little bit more about diabetes. If you yourself are wondering if you are on that path, would like to know more information about it, feel free to contact our office. We have the resources necessary to help you not only find out about it, but work towards the improvement of the status itself.